All this is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So hope you're doing well. Roman is here. Hey, Roman, how are you? Roman, how is your new assignment going? Posse is here. Hello, Posse. DDS is here. Hello. DDS, I did not hear what is the cool day today. Algebra Bean is here. Christy is here. James Crooks is here. Richard Jeffrey is here. Barbara, hello. How is Lotus? You know where Luffy is? Luffy is outside. Luffy nowadays would not stay inside the house anymore. He is done with the house. He just want to be out. And today Kyrie made a mess. So today was Kyrie's vet appointment. So she entered that little box in which she goes to the vet, and she became very agitated. And then it turned out that the appointment is actually tomorrow. So on the way back, she peed in the box, and we didn't realize that she had done it. So when we brought home, opened the box, and now the all soaked in pee Kyrie ran around, and the whole house had to be cleaned up. And Kyrie given a shower, a bath, which she hates even more. Okay, cool. So today I may have to go in half an hour. I have a appointment with my brother, my older brother. He's in the East Coast time zone, so it is kind of getting late for him, and I have a quick call for him. I had asked him that I'll call him after the discussions. All right, so how are things? Sandy says, thank you for keeping going. You are very welcome. I'll continue to go as long as I can. And when somebody would stop me, then I'll stop. Andrew says, howdy, Dr. Bean. Hello, Andrew. How are you? So Kelly Holmes says, spike protein is known to be toxic and now in all vaccinated people. It was produced in all vaccinated people at some point, and then it was not produced anymore. So you are partially correct. Now, cytotoxicity of the spike protein is true, but you have seen that there are so many millions of people who are vaccinated. Roman says, Dr. Bean Medical Lectures, new gig is going well, really busy and exhausting, but nice to be working again. Absolutely. So very good. When is the party? When are we getting together and celebrating? Augie says, hello back to you. Howdy from South Jersey. Hello back to you. Jack says, am I back? Yes, you're back. Elaine says, hi, Dr. Bean and Luffy. Hello back to you as well. Cindy Glasgow is here. Hello, Cindy. How are you? So Andrew Brady says, can you post the video from your talk at Pakistan Medical Conference, please? So my presentation to Pakistan Medical Association was their property because they had set it up. What I thought was to do, and I did not get a response. I asked this question yesterday. What I thought to do was to take that presentation that I used to present to PMA and present that to Cool Beans here as well. Of course, I talked a lot about medicines and the management protocols. I want to make sure that that is not a medical advice. It's just a management protocol for a healthcare professional's information. So if you like, if the Cool Beans like here, I can present that tomorrow. Kelly says, Dr. Bean, so glad I found your videos. Thank you for all you're very welcome. So glad that you are here. So Keyring says, how common are serious allergic reactions in second dose Moderna vaccine? Is it more or less common than reactions to the first vaccine? It is less common than the first dose, but second dose reaction can occur as well, less frequent than the first one. Jennifer says, Pierre Corey says he thinks Nebulize 1 to 3% H2O2 could be effective, and another doctor says he's seen 300 patients successfully treated with it. Thoughts? So I will do some research. I have always looked at some data researches before I open my mouth about some management. So I would do some research about it. Let me actually take a note. Sorry about the mouse sounds. Excellent. That is done. I took the note. I'll talk about it. Rob has a good question. Rob says, Dr. Bean, is the vaccine causing innate immune system reset for those suffering from adverse long symptoms? Adverse long symptoms after the COVID infection? I don't know. In some cases, people have reported that they had the long COVID and then getting the vaccine helped them. But not in all cases. In some cases, people actually said getting the vaccine made it worse. I actually know a family member whose COVID was asymptomatic. It was discovered just on her routine examination at her doctor's. And then she got the vaccine, and now she is a long COVID or long haul patient, and it's quite frustrating her. So I think I've seen it both ways. I've heard from people that after getting the vaccine, they improved a lot. And I'm also seeing people who got it. So that means there is no correlation that can be formed. And this long COVID or lingering issues are issues. I still think that these 3-4 thoughts that we have seen so far. Number one, possibility of blood cell. Remember, I discussed that study that blood cell phenotypical outcomes, the structure of the shape and structure of the cells may not be correct after COVID. Second is the S1 part of the spike protein hanging on in monocytes and then causing inflammation. That is Dr. Bruce Patterson and al. Then Dr. Paul Marek, I showed that study a few days ago where they saw that S1 could cause acute lung injury. So that means S1 part of the spike protein could cause injury. The whole spike protein itself does not cause that much of an injury as S1. And then the possibility of mast cell activation syndrome, possibility of the macrophage activation syndrome, possibility of immune dysregulation for other reasons, all of them together could be, or combination of them could be part of the long COVID. So various people have various reasons for it. Trillium Lane says, hello, back to you. Delicious goat says hello, hi, back to you as well. Okay, so how are things? Jax L says, since Pfizer has been approved, why I haven't gotten Moderna and J&J lost their EUAs? Because it is possible. There are many medicines that get emergency use authorization after existing approved medicines in that category. The question now is, I think that will be a fight between these big pharmas to say, can they now get approvals as well, or what is going to happen to them? And that also is a tricky situation for Novavax to say, can they get into an EUA before US just simply says, you know what, we're done. So Augie says, any update on decreasing spike proteins in monocytes and Dr. Patterson? So I spoke with Dr. Yo this morning, and he said that it takes about 8 weeks with their therapy, and in the majority of the patients, the spike proteins disappear, or the inflammatory markers that kind of indicate that there are spike proteins still there, or S1 portions, they go away. And the question I had called him for was, what is causing the relapses? I'm seeing in some patients, the relapse is actually even severe. And he said that in some cases, what they're seeing is that this is actually a re-exposure to COVID that is coming back as severe symptoms. It's not really a relapse in many patients, and it's just another exposure, which makes sense. So Andrew Brady says, have Pfizer and Moderna been updating the vaccine spike protein to keep up with the variants, or would they have to seek new approval for such changes in the vaccine? So I think they have not added those changes to current vaccine, but I am sure that they are working on the changed or modified structures. I don't think they would need to go through the trials. I think they would still have to get through some approval and some level of testing as well to say this newer structure works okay and is not harmful. The great I am says CDC are doing studies on the impact of CoQ10 on fatigue in long haulers. Do you know the results and dosage? No, I do not. I haven't seen that study yet, but I had talked about CoQ10 about a year ago, that it is a very important product that helps with the electron chain in a cell and the reactive oxygen species reduction. So it's an important thing. Matthew says, can common cold virus pick up injected messenger RNA and get SARS-CoV-2 spikes, cause positive? No. So for a common cold virus, most of them are, let's say, DNA virus. For them to get in a piece of RNA and integrate it into them is very difficult. Can RNA pieces, for example, little plasmids with DNA, can they go from one pathogen to another, bacteria to another? Yes, they do that. Can there be pieces of RNA that can get into the other viruses? Possibly. It is very difficult for a virus to pick up another RNA and integrate it into its RNA. It needs the whole machinery to build that system. These are not just simple magnets sitting in our body to say, you know what, I'm just going to become attached. There need to be enzymes that have to create nicks in the system. They have to put the new gene in there. Then they have to stitch them back. The gene need to have a promoter region. Then that should be able to function correctly. The whole thing should be able to survive correctly. The proofreaders should be working okay with that. So there is so much that automatic absorption of genes is going to be a very difficult thing. Yes, manufacturing, just like we make plasmids or other genetic material and insert that in various plasmids and bacteria, that is possible. Just like we take adenovirus and make and inject this messenger RNA gene in there, not messenger spike protein gene in there. So that is what we do. But viruses generally cannot just wholesale pick up such things and just take them. So Jamili Zal says, hi, Dr. Does the vaccine work for overweight people? Yes. So I just discussed that in my last talk from UK. They said that in morbidly obese folks, the vaccine efficacy stayed almost the same as not obese folks after the 10 days or 14 days plus of the second dose. So yes. I haven't talked about mu yet. Will do. M. Gregory says, is it mostly asymptomatic people spreading the virus? I would say it this way, that mostly those who are asymptomatic feel they don't even know, and they don't feel sick enough that they, for example, if somebody becomes sick, they would stay home. They'll be bedridden, or unfortunately, they might be in a hospital. So they are still shedding as well, the sick folks. But yes, those who do not have symptoms and have virus, they will be moving about and they will be less careful, and they would be shedding as well. Matthew, thank you very much for the super sticker. Kevin says, do you believe COVID is, in a sense, going through a peak regarding its essential lethality and will in time become another normal flu? That's what I have been saying for a long time, that as it becomes more and more contagious, it should reduce in lethality. So ideally, the lethality of this will continue to reduce as it becomes more and more humanized. And that should be the normal expectation. So Manoj Kumar says, what is your thoughts on nitric oxide nasal spray for COVID-19? Manoj, I did a discussion about the nasal spray based protection for a Canadian company a few months ago. And I think that spray got approved. I believe it was in Israel and UK, I think. So there is good efficacy with those sprays as well. I did a complete video about it. Cat says, Cat looking up, we can't trust the doctor saying anything. So sad we don't trust medical doctors. I'm sorry about that. Ushalmo says Pfizer did not make the vaccine. So yes, Pfizer is the platform, and the BioNTech company is the one that was a small startup. That is the one that made the vaccine. This was a Turkish couple who was living in Germany, and the company name was BioNTech, who made this Pfizer BioNTech vaccine. George has an interesting question. So, how does the vaccine COVID affect people with a history of endothelial dysfunction, history of heart attacks, CEA, Thanks, love the channel. So, we know that cardiac issues are a risk factor. That is what is known from all the studies so far. This very specific endothelial dysfunction, I haven't read any study that specifically talks about a patient of endothelial dysfunction and then COVID. But cardiovascular system issues are a risk factor. George, I'll have to look it up. That's a good question. There is a question from Jennifer. Methylene blue acts as oxygen in cytochrome C to make ATP, helpful for COVID hypoxia. Can't say it without a study. So I will write this one down as well. Cool beans know that I try to make sure that I have some data back up my discussion. Good question. I took a note. Gloria says doctor demands a study into the link between COVID vaccine and blood clots after his research found clots in a majority of the vaccinated patients, some of whom could be dead in 3 years. Adan Salazar. That's why would they be dead in 3 years if the clotting is happening now? This is just not the best thing to say. Or Alquin says, what is your favorite pop artist? So I used to be mad about or crazy for Michael Jackson, then Madonna, then ABBA. Who else? I mean, of course, I loved singers from my own culture as well, but these. Then in those days, there was some more that came up and then went. There was a 12 inches of pleasure. That was very, very good band. There was I forgot the singer's name. The River Cried. That used to be a very good band as well. I forgot the name. What is that country singer? I love that country singer. So let me actually see what is the. It is, the one that says you should know when to hold on and when to fold on. What is his name? Let me see very quickly. Kenny Rogers. Yes, I love Kenny Rogers. I love Kenny Rogers songs. Kenny Rogers, I can listen to Kenny Rogers the whole day, whole night, anytime. Michael Jackson, I'm a big fan of his songs as well. Who sung the River Cried? I forgot his name. Then, if you remember the song that was "Carry Me Like a Fire in Your Heart," I love that song. Then "November Rain," I love that song. November Rain, I can just listen to that one song again and again forever. Dancing in the Dark. Then This Gun's for Hire. We Will Rock You from Rocky. So I used to love these songs. So Cry Me a River, Justin Timberlake. Crazy German Shepherd says, you must be my age. Okay, so a couple of more questions and then, so yes, so these were 80s and 90s. These were 80s and 90s. I love these songs. Bruce Springsteen. I love Bruce Springsteen's songs. Summer of 69. I was born in 69, so Summer of 69. I love that song. Okay. Humble Bean says, your opinion on the pre-probiotics for SARS-CoV-2 positive patients, very useful to optimize microbiota as a problem, don't you think? Absolutely. And there's a paper that will be published soon, if not already published. I am spilling the beans for Dr. Paul Marek. I should not. That paper is about microbiota as well. I should just stop here. It's not yet printed. So yes, very, very important. Microbiota and its management. Let's use this as our last question. My apologies today. I have to work with my brother. I saw a lot of people in groups saying they are infected by COVID months and year apart. Some got reinfected 3 times or 4 times. Is this possible? They're mostly vaccinated post and pre-COVID. It is possible. So we have done this discussion many times that a person can catch COVID again. And I had been saying it till before this became a mainstream discussion and news, because it's a respiratory virus. It would arrive in our mouth and nose. You cannot stop it from arriving there. Vaccines, when they are in an active state, they may be making enough IgAs and making enough B and T cells to contain it. But if the immune system has gone in a resting state, it would take about a couple of days to wake up and work Meanwhile, the virus would just land. As soon as it would land, it would go to work to make more and more viruses that can cause infection and symptoms. So it is possible to have that. One of my students, who is a doctor now, he had developed COVID last year, pretty not serious enough to take him to the hospital, but he is overweight. And so he became really, really sick with it. And it was, I think, 2 weeks of very hard time. He just sent me a message a few days ago, and I was talking about something else, and he was sounding really bad. And I said, "What's going on with your voice?" And he said, "I think I have common cold." And I said, "Your symptoms," I called him, I said, "Your symptoms look like COVID." And he said, no, this is not COVID. I'm vaccinated. I had COVID before. So it must be just normal common cold. Then a day later, he called me and he said, very surprisingly, I cannot smell anything. And so it was COVID. I asked him to do the COVID management. So to answer your question, yes, it is possible that reinfection can occur, re-exposure can occur that can cause reinfection. So with this, with your permission, just for today, I want to go a little earlier. I have a quick task to do with my brother. He's on the East Coast. It is 10 o'clock on his side. I don't want to make him wait too much. So I would see you tomorrow. Please stay safe, happy, and healthy. There are 3 links in the description if you would like to support this work. Like, subscribe, and share. That is one. And then you can become a patron, or you can use PayPal to support this work, or you can buy me a coffee as well. Thank you very much, and I'll see you tomorrow.